Hey guys, it's Kathy. So, welcome to my weekly live session here on YouTube. I'm hoping that a lot of you can join us here today. So, we put out a survey last week to find out what day and time worked for most people. And for most people, it sounded like Friday was the best day, which was surprising, and then later in the day. So, hopefully, this will work for a lot of you. I did get some questions ahead of time that I'll be addressing today during our live session. So some of the questions I got included some questions regarding advice for new grads, especially new grads starting right now during this pandemic. There was also some questions about the new NCLEX and the shortened version of the NCLEX. There was a question about dealing with stress and feeling out of control. Also, there's one student who's starting their program on Monday and wanted some advice on how to be as successful as possible and, basically set themselves up for success. And then I had a question from a nurse who is coming back to nursing after a 2-year break. And then someone else who has a goal of being an RN, but is considering different paths to getting there. And then finally, some questions around graduation on time, given all the school closures, things going online, things getting delayed. So those are some of the things that students sent me ahead of time that I'm going to talk about today. So I'm going to be trying to keep an eye on comments as well. So if you guys have questions or anything, I'll try to kind of go back and forth. So hello, guys. We just had our first med-surg lab. Awesome. I hope it went well. Be curious what you guys did in lab. Hi, guys. Hi, Monica, Maya. Is it Pampa? Hey, guys. And then Yasamine. This is my first time watching your live. I wanted to thank you for helping me pass my AT on a third attempt. LOL. I have not taken my NCLEX yet, but my RN is active due to COVID-19. Okay. I know there's a lot of, there's some states and nursing programs are really making some accommodations to help people get their license, to relax some constraints around clinical hours and such. So that's great if your program in your particular state is working with you on that. Hey, Sydney, Harjeet, Katmat, Veronica, and so glad you guys could all join. Miriam, Andrea. So, Kathy, any advice in seeking employment during the pandemic? Well, depending on where you are, you may be able to easily get a job because there's definitely some areas who definitely can use some help. They're pretty overwhelmed, depending on where you live. Okay. Hi, Kathy. I am a PN instructor and I have encouraged some of my students to watch you. You're awesome. I'm super happy to help. So between your instructors and me, we can get you through this and help you learn the material. All right. Hey, Gloria, Quita. Hey, from Tampa. Good to have you guys join. So, hey, someone did ask me, did I have advice for new grads during this time? And boy, that's a tough question because really being a new grad in general is tough as is, right? Much less being a new grad during the pandemic. So when you're a new grad, you're learning so much. Yeah, you learn a lot in nursing school, but just so much is thrown at you as a new grad, and you're learning to take care of, 4 patients or more, and, safely pass your meds and assess patients and advocate for your patients. It's a lot. And I always tell people that first year, especially, you just have to give yourself so much patience and grace because you're going to be learning so much and it can be hard. I remember coming home as a new grad, just, frustrated some days that I was just spread so thin and I just couldn't, seem to keep up with, the pace I needed to be at and to do all the things I wanted to do. So particularly with the pandemic, right? Things are going to be a little cray-cray at work and people are going to be a little stressed. There may be, people running around with their heads cut off. It may be a little crazy. And that certainly doesn't help you as a new grad to kind of learn a good, foundation and to ease into things. So the first thing to remember, if this is your situation, is just you want to maybe understand that things are going to be different and a little hectic as a new grad. And again, you're going to have to give yourself a lot of grace and patience, and don't throw in the towel. Don't think that this is always how it's going to be. It will get better when we get through this, and we will get through this. Things will normalize. So don't throw in the towel on your nursing career just because it's going to be really crazy when you first start. So you're just going to have to take a deep breath, do the best you can. You want to protect your license, right? So you don't want to be doing procedures or things that you're not qualified to do. Like, don't operate outside your scope of practice. If you haven't done a procedure or something before, then get help. Have someone kind of, shadow you, watch you, teach you. So protect your license, get the help you need, really advocate for yourself. Let's see. Protect your license. Again, hang in there knowing this is not kind of a normal state. So if you can hang in there, things will calm down. And again, it takes a while until you are confident as a new nurse. I think it was a year before I really felt like, oh, okay, I'm getting the hang of this. I get how to advocate for my patients. I understand what doctors want to hear and report, what other nurses want to hear and report, what CNAs want to hear and report. It takes a while to kind of develop your rhythm and to feel comfortable. Okay. So that's new grads. Let's see. Let me come back to questions here. Paola, hello, Cathy, much love. Let's see. Is it Emma Rosa? I have 4 weeks left to finish my program. I couldn't have done it without you. I am forever thankful for your dedication to help us succeed. You are so welcome. I am so grateful that I could be part of your journey, and I'm really happy that I could help. My ATI comprehensive is coming up in a week. I have 2 attempts to pass with a 78. I'm nervous, but I know I can do it. I know you can do it too, for sure. Make sure you take lots of practice exams. And I know I'm kind of a broken record on this. Practice exams are where it's at. Take them. Definitely read all the rationales and explanations very, very carefully. You can learn a lot from that. And then that should help you be better prepared going into your proctored exam, okay? All right, Dalton, you're my favorite. Yes. Rashidat, I'm sorry if I pronounce any of these names wrong. Super sorry. I'm still in school for LPN. Please explain how I can pass my NCLEX at one time. So if you're still in school, then do your best while you're in your program to really master the material, build that strong foundation of knowledge, right? Because you just want to take that time to really learn the material as best you can. And then when you finish your program, then maybe you can spend a month or 2 working on practice exams for the NCLEX. I particularly like UWorld for practice questions. Some of them can be kind of tough, but they give really good explanations and rationales. And also during nursing school, make sure you're taking practice exams along the way, and that will also help prepare you for taking the NCLEX when you get out of school, okay? So Monica, I am worried about the NCLEX being shorter. Okay, yeah, so I did get a couple questions about that. With it being shorter, it does mean that you're going to have less time, less questions to prove yourself, right? The way the NCLEX works is you take questions. If you do really well, you're getting them right, those questions will get harder and harder and harder. You'll get more select all that apply and prioritization type questions. And if you keep doing well with those, in general, then the test will shut off at 75 questions and you'll pass. If you're kind of borderline and maybe getting some of the questions right, but some wrong, and it takes more questions for you to prove that you know your stuff. So that's when the NCLEX goes on longer and you get more questions. So with the shortened version, it just means that you have a shorter amount of time to kind of prove that you know your stuff. So it will shut off at 60 questions. Either way, right? You've either proved at 60 questions, you know the material well enough, or you've proved that you don't. So you definitely want to go into your NCLEX prepared. You want to have just a strong foundation of knowledge. That's where we can help here at Level Up RN. So our videos, which are free, there's hundreds of them here on YouTube, can totally help you understand the key concepts you need to know. In addition, our cards with the videos are I feel like it's really a powerful combination. Being able to have those study cards, be able to go through them anytime you need to, right? So either make your own study cards or use ours. But I feel like flashcards are definitely really important for retention and repetition. And like I said, the videos can help too. So with the cards and videos, you could build this strong foundation. And then I would take at least a month, maybe 2, to work through some practice exams for the NCLEX so that you could go in there confident and hopefully get that thing done in 60 questions and pass and be done. Okay. All right. Let's see. Hi, Cathy. I'm assuming 4th semester NS, just got word from my nursing faculty that they canceled our capstone. Super disappointed. I was supposed to do a 7 to 12s in ICU. Yeah, no, it's a bummer that people are getting their clinicals canceled. This is, obviously super valuable experience for you guys, going to clinicals, having your preceptorships. I was having nursing students shadowing me at my hospital once a week, and their clinicals got canceled. So I don't have any nursing students with me right now. And nothing will ever truly replace a clinical experience, dealing with patients, taking care of patients hands-on. However, make the most of your time if you can. I know a lot of schools are doing some online simulations, which can be helpful, and just use this time to what I call sharpen the saw. Basically, just start mastering your knowledge and getting ready for NCLEX. So I get that having this clinical experience taken away from you is just so disappointing and frustrating. I totally get that. But just make the most of the time to really master the material so that you're all set for your NCLEX or for your, predictor exams at school. Just make the most of it. And when you get that first job as a nurse, trust me, you will be getting lots of clinical experience and you'll learn very quickly. It takes a while to learn everything, but you're going to get a lot of experience really, really fast. Okay, let's see. Hi, Cathy. Thank you so much. I was struggling and your videos and flashcards have helped me to level up. I couldn't have done it without you. Yes, super happy to help. And I'm so glad those things were helpful. Hello, Cathy. I have had to retake MedSurg ATI. I've been studying your MedSurg cards. I'm so nervous. Okay, so when you're studying, I'm glad you have my cards. Try to space out your studying if you can. Try studying several hours in a day versus these marathon sessions of 10 to 12 hours, right? So study for several hours and do it over multiple days. Research shows that it really helps you to retain the information better if you space it out like that versus doing this binge session. I took my cards with me everywhere, and I guess while we're quarantined, we're not going anywhere really. We're just hanging out here. I used to take them to pick up my kids and on walks, etc. So you could probably still go for a walk depending on where you live. But yeah, you're going to be staying put in your house. So definitely just kind of space out your studying over multiple days and, watch the videos with the cards, because really that combination is, like I said, pretty powerful. Hearing the information, seeing the information, and then going through it repeatedly. And then lastly, do the practice exams. Do as many practice exams as you can. Go through them slowly. Read the rationales and the explanations. And for questions that you get wrong, like you didn't fully understand, go back and read that applicable section in your textbook, and that should really help. Okay. You don't have heart failure on YouTube. That may have been one of the videos I had to take down for now. Is the new NCLEX just temporary? I graduate in September 2020. I don't know that for certain, but I am guessing that this new shortened NCLEX is probably a temporary situation, and that once we get through this COVID-19, they probably will go back to their normal format where it's 75 questions minimum, and I think it goes up to 260. I forget what the max is. Let's see. Going into Med-Surg 3 next term and extremely excited to almost be done for sure. Thank you so much for helping me get through nursing school. You're so welcome, Catherine. I'm super happy to help, and congrats for being on the home stretch here. So you're right around the corner. Okay, let's see. Oh, I've been studying all of your flashcards and they are super helpful. Any advice on select all that apply questions? I actually got a question about that too. Someone asked me, for select all that apply, will you always have more than one correct answer? So officially, you can have, for select all that apply questions, one question or one answer may only be right. That can happen. My experience in general with select all that apply questions is that it's usually 2 to 4 answers that are usually correct. So whenever I would take my test, if I had a select all that apply question and I only selected one answer, I would really question myself and go back and really review those other answers to see if there's another one that I should be selecting. In general, I feel like two or more is usually the right way to go. That being said, it is absolutely valid and it can happen where there's just one right answer. And also on the other side of things, if I selected all the choices as right, I would be really hesitant to submit that. I would feel like at least one of those things is probably not going to be right. So I would go, if I did that, I would really go back and review my choices and really think about that. Again, you don't want to get caught into this like second guessing all of your answer thing. I would not recommend that. People mess themselves up all the time on tests by second guessing stuff. But when it comes to select all that apply, I would possibly go back and review your answers if you've only selected one or if you've selected all the answers, okay? In general, select all that apply are basically true, false statements. So you read the question and you got to see what is true or what is false about that statement, depending on the question. So it's kind of like yes, no, yes, no, yes, no. As you're going through a select all that apply type of question, make sure you're not selecting things that are conflicting, right? You never want to choose two things which conflict with each other. If there's two answers that are conflicting, you're only going to choose one or the other. So that is one thing to keep in mind. I would also be wary of answers that say things like always do this or never do this. Sometimes those things are not correct. So just, be wary of selecting answers that have those type of, uses that type of language. Okay, let's see. Cathy, you're the best teacher. This is from Peace. I love you. And I like the way you simplify the topics and hit them on the important points. Your teachings help the topics stick in. Just want to say thanks. So I love that. Thank you so much, Peace. I'm really happy that my teaching style works for you. And I love teaching. I love sharing information. I love helping students understand the key concepts. And I have every intention of keeping going with this and doing as much as I can to help students. Okay. Let's see. Can you tell me more about the flashcards? I want to purchase them. Also, do you have workbooks? I don't currently have workbooks, but I do have a variety of flashcards. There's actually a package right now on our website that is designed not only to help nursing students, but to help like retired nurses or nurses who are in transition, like that are getting pulled off of their current job and being put into a new position, kind of hit the ground running. So the name of that package is the Fast Track Nursing Review Pack. It's on sale. It's a 4-pack. So it contains pharmacology, lab values, medical surgical nursing, and health assessment. So it's a really strong foundation to help people kind of understand the key concepts and be ready to go. So again, both for students and nurses, it is for sale on our website. Our website is leveluprn.com. And then Angelina, I'm going to have Angelina put a link to that special deal going on right now. And there's lots of information about those flashcards on the website, exactly what's included. There's pictures of the flashcards, and it gives you like a breakdown of all the topics covered in them. So Angelina, oh, sorry, you already posted the link. So Angelina posted the link. So check it out. It's a really good deal right now. And like I said, flashcards for me are like, they're bomb. That was kind of my secret weapon in nursing school. Either make your own or use mine, but flashcards are great to use. Okay, let's see. Cathy, do you think that the NCLEX will include COVID questions now that it is a pandemic? I don't know for sure, but I would guess no. I don't know that those NCLEX questions are like so up to date, right? That are like, just in time. I doubt they're going to be asking specific questions about COVID, but they may be asking questions about viruses in general. And COVID is a virus. And so, they may be asking you about viral infections and can you use antibiotics to treat viral infections? So the answer to that is no. And, you may get questions about antivirals, that type of thing, but I would be super shocked if anyone got a COVID-19 question on the NCLEX right now. Okay. I used your amitriptyline on my last exam. Thanks so much. Flashcards and videos, very helpful. Yeah, so I'm all about, amitriptyline, I've got my like weirdo hint. I'm all about the crazy little stories or tips or hints for remembering medications. So for those of you who don't know my like amitriptyline, amitriptyline is a tricyclic antidepressant. The way I remember what it's for and the key side effects is I remember that a little girl named Amy tripped over a tricycle in the desert where it's very, very dry. So by thinking of that little story, I can remember that amitriptyline is a tricyclic antidepressant and that it causes anticholinergic side effects. So sedation, blurry vision, possibly urinary retention, that type of thing. And then I also have my like rated PG-13 hint for remembering anticholinergic side effects, which is can't pee, can't see, can't spit, and can't poop, right? Because it causes dry mouth, it causes blurry vision, urinary retention, and constipation. So definitely know your anticholinergic side effects. Okay. Pharm is still my weak subject. I have your cards and I've gone through all of them, listening to your videos. I'm going to keep going through them and do practice questions. Yeah. So repetition is huge. So I was terrified about pharm even before I started nursing school because memorization for me is not my strong suit. Like I really like the more critical thinking stuff, but just flat out memorizing names of medications was not, was something I was kind of scared about. Like anatomy, as far as prerequisites, that was probably my toughest prerequisite class because it's just memorizing so much information. So really repetition is key. So when you are looking at the flashcards, pull out a section, like just pull out the mental health meds and spend some time on those. And then another time, maybe just pull out like your cholesterol medications and work on those. So you just want to work with a chunk of the meds at a time. And you definitely you have to come up with some trick or way to remember the drug name and what it's for. So in my video series, I offer my little silly ways to, remember things. I also put out my like tips of the day on Instagram and Facebook and stuff. And I definitely share some of my silly ways to remember stuff on those social media sites. If you don't like my way, then come up with some other way. So another one of my silly ways to remember a medication like colchicine is a medication used for acute gout attacks. And if you look at the word colchicine, it looks like cool chicken. So I think about a guy with his friend who has a chicken, and the guy's like, hey man, cool chicken. And then the chicken like pecks the guy's toe, which has gout, right? Because when a patient has gout, it makes their toes really, really painful. So I think about this chicken pecking this guy's toe, and that helps me to remember that colchicine is for gout. Okay. My friends always say how much we wished you could teach us in real life. I know, I get that. I get people telling me that, but I feel like someone's like, oh, you should teach at a college. Well, if I taught at a college, like one college, then it would just be those students who would benefit from, my videos or from me teaching. And I feel like I can reach a lot more people this way and help a lot more people. So just think of me as like your alternative teacher, or like a supplement to your teacher. So I'm here for you and everybody else too. Okay, let's see. Hi, Cathy. What are some studying tips for mental health questions? I have my ATI next week. Thank you for all the information. Okay, so I do have mental health videos still available on YouTube. I would definitely spend some time studying the mental health medications, like medications used for depression, anxiety, bipolar, schizophrenia, ADHD, alcohol, withdrawal and maintenance, that type of thing. So definitely don't skimp on those meds. Definitely understand therapeutic communication, right? So if you take enough practice exams, you'll get really good at these therapeutic communication type of questions. When you're talking to a patient, you never want to say why, right? You never want to start your question with why, because it kind of puts the patient on the defensive. So why would you do this? Or why did you do this? And that kind of shuts down communication. You also don't want to offer your advice. Like, if it were me, I would do this, because that doesn't really help communication as well. You really want to ask open-ended questions. Your goal with any of these like therapeutic communication questions that you may get on exam is you want the patient to open up and share more information with you. So you can say things like, you seem really sad, or you seem really angry. Can you tell me more about how you're feeling? That would be a good therapeutic response. So for mental health, definitely know your meds, definitely know therapeutic responses, take a lot of practice questions so you get really good at those. And then of course I would know, key information about depression, anxiety, schizophrenia, bipolar. I'd also understand defense mechanisms and like personality disorders as well. Okay. Really appreciate your unlimited support to advance our career. What do you advise the one who left 2 weeks for the NCLEX exam? I'm not sure what that means. Do you say like you have 2 weeks left until you take your NCLEX exam? So, and then someone else asked here, can you please recommend what an NCLEX review program, UWorld versus Kaplan? Okay, so I've seen both types of questions. I actually I've used both. So I personally like UWorld better because I feel like the explanations and the rationales are way more comprehensive. Kaplan's a solid program as well. I'd say Kaplan and ATI are more similar. UWorld is a little more comprehensive. When you go through the UWorld questions, just keep in mind that your score may not be the best. Like when I first started taking UWorld, I was a little bit freaking out about my scores not being as high as I was used to them being. And UWorld is a little harder. So if you can get good at UWorld and really read those rationales and the explanations, then you're going to be pretty well prepared for the NCLEX. If you're scoring super low on UWorld and you just don't feel like you have a grasp on the material, then I would not rush in to taking the NCLEX. I would really take a step back and maybe use our materials here, our videos and our flashcards to really build a stronger foundation before going in to take NCLEX. Because it's, you know, it's a definitely would be a huge ego blow to go in there and take the NCLEX and not pass. I really want to see all of you pass. So I want you to go in there well prepared and confident. So we're here to help with the material. Okay, let's see. Can you say more about NCLEX practice questions? So yeah, UWorld. And again, no matter what platform you use, whether it's UWorld or Kaplan, there's a really great NCLEX Mastery app as well that I use during nursing school. Make sure you read the rationales and explanations slowly. So you're not going to fly through these practice tests, right? I don't want you doing hundreds of questions a day. I want you to limit it to like 50 or 70 and really go slowly. Make sure you understand everything before you move on to the next question, okay? Endocrine system. I'm going to have endocrine system information coming. I'm definitely planning on covering the endocrine system. I know the endocrine system is tough for a lot of students. I love teaching the endocrine system. So I'm definitely got some stuff in the works here, and I definitely plan on teaching that material. So stay tuned. Make sure you subscribe here on YouTube, and make sure you sign up for our email list on our website, leveluprn.com. We've got a lot of exciting things in the works, so you're definitely not going to want to miss out on that. So, okay, let's see. Okay, so someone there, I think it was Yali, said you did a really good job on UWorld, but then failed the NCLEX. It was content questions for me in UWorld. I was recommended Kaplan, and they teach you methods to take the exam. Yeah, so if you you feel like you need more test taking techniques, I can see that. I can see where Kaplan might be a better fit for that, and they'll help you with those test taking techniques. If you're trying to more learn about the material and really refresh yourself on those materials and get practice exam questions, then I personally like UWorld. Okay. Crystal, your videos are so wonderful. Thank you very much for your live sessions. It's an encouraging way to learn, and also feels like we're sitting together having a chat. Yes, it's something I look forward to. I'm so glad. I was actually thinking today, you know, this is my my third week in a row doing it. I was like, well, I hope it's not getting old for people. I hope it's helpful. Happy to spend the time and to reserve a spot every week to do this, as long as people show up and then people are finding value from it. Okay. Let's see. How do you have any advice on how to prepare for the HESI exams? I have mine coming up at the end of the month for Foundations of Nursing, and I bought some of that information, but you're also going to want to study some other fundamental type information. And we have a video series for fundamentals. So definitely check that out, because you're going to want to really understand some of those nursing basics, like the nursing process, like informed consent, like contact precautions, use of restraints, how to prevent people from falling, those kind of basic things. So definitely check out my video series on fundamentals, which will definitely help prepare you for that exam. And just keep in mind, whether it's like ATI or HESI or UWorld or whatever, as long as you have that strong foundation of nursing knowledge, you will do great on any of these tests. Okay. Hi, Cathy. My farm flashcards just arrived today. Thank you a ton. Your lecture are very helpful. Me and my husband listen to them together, and we really appreciate your time. So that just cracks me up. Like I've seen that a couple of times where the spouse, like a husband's like listening with his wife, and man, God bless all the husbands out there who want to listen to me with their wife. That's some real dedication and love. I can totally say I have an amazing husband. Like, we've been married almost 25 years. There's no way he would listen to nursing lectures with me while I was in nursing school. Probably because he was too busy taking care of our 2 kids and grocery shopping and doing like everything to try to support me while I was in nursing school. But it just reminds me of a funny story. I had this one nursing student who said she left this really awesome review and just a big thank you on YouTube. And she's like, I listened to you like every night, like while she was in bed with her husband. And I guess her husband was like, please, no more Cathy. Please, no more Cathy. And so I just died on that one. Like this poor guy having to listen to me every night and every night before he goes to bed. So you married a good guy who's willing to do that. Okay. So tell your husband I said hi, by the way. This is for Aster. Okay. Did you experience bullying during nursing school? I'm a little more mature than my classmates. Not by choice, but hardship experiences. My classmates don't talk to me. I feel like they think I'm weird. Yeah, you know what? I hear about stuff like this. There's definitely kind of cliques in my nursing school, but not too bad. But I definitely hear about people, some students feeling like are on the outside, that they don't really belong, that people aren't very nice. There's definitely I guess I was in an ABSN program, like an accelerated program, and some people are pretty intense. And I guess my personality is a little intense too, but some people, there was some dynamics going on there. And that can be hard. I have had a little bullying as a new grad nurse, right? Like I've had some nurses kind of give me the eye roll and be kind of condescending to me sometimes as I'm learning, or if I hadn't done something before and I was asking for help. And my approach was really just to be really honest. And, I had this nurse one time where I was coming off night shift, giving a report to her, and the feeding tube was almost empty, like the formula. And I hadn't changed the whole feeding setup before. And I was like, can you help me, or can you watch me to make sure I do it right? And she's like, really? She gave me the whole eye roll. And I'm like, yeah, really. Like I haven't done it before, and I'd really like to have you watch if that's okay. And clearly it wasn't okay. So she was kind of mean. And then, but I kind of just let her know, like, no, I haven't done it, and I'm not going to be made to feel really bad about that. And later on, she goes, did I hurt your feelings? And I'm like, yeah, you did. And then I thought she was like kind of taken aback that I actually admitted that. So like, I'm sorry. She's actually really cool and nice to me now. But at the time, it was kind of like really judgy. Obviously, there's much worse bullying out there. That's my little bullying experience. Some nurses can be harsh. And I guess in nursing school too, I didn't have bullying, but I hear that it happens, and it makes me really sad that happens. If you can try to make an effort to connect with some like-minded people in your class, maybe it's some of these other students who are a little quieter and you can reach out to them. Maybe you have more in common than you know. So just try to find your group, try to find your niche, and then also just remember why you're there. It's great to have, friends and to feel supported in nursing school. That's, obviously really important. But at the end of the day, you're there to learn. And I feel like out of the whole class, there's got to be one or two people that you can hopefully connect with and try to ignore these bullies. Or, if it's really bad, then definitely maybe talk to your administration about what's going on and maybe get some advice as well about the specific situation. Okay. Do you have cardiovascular on YouTube? Yes, I have cardiovascular on YouTube, so definitely check it out. Let's see, make sure to hit thumbs up. Oh, that's Angelina. I'm reading your comment, Angelina. So for people who don't know, Angelina is part of the Level Up team, and she's my right-hand gal, and she keeps me straight and helps me out with these things. Okay, thank you for smiling all the time because it relieves my stress level. I'm so happy. I'm glad it helps. I try to smile. It's been a few videos where I haven't been able to smile, but I smile as much as I can because in general, I'm pretty happy. I love my job as a nurse. I'm a wound nurse. I love my job and at the hospital, but I also love this job, right? Which is teaching and supporting nursing students. So I've got an amazing husband. I've got 2 great kids. I've got a lot to be thankful for. I have a lot of, I often have a lot of stress in my life too, but in general, I'm pretty blessed. Okay. They always say nurses eat their young. Yeah, that happens sometimes. So here's one thing I want to tell you guys. Because when you go to clinicals, everybody at one point gets a nurse assigned to them who really doesn't want to have a nursing student, right? And you can kind of see them like kind of roll their eyes or whatever. And it's so discouraging as a nursing student. You're there in clinicals wanting to learn, wanting to help. And it's a bummer when you're paired with someone who obviously doesn't want to have a nursing student. So I love having nursing students. It's the best. And there's a lot of good nurses out there who like to have nursing students. So just remember how it feels when someone doesn't want to have you there. So that way, when you become a nurse and then you're assigned a nursing student, that you can just take them under your wing and just be really cool and nice and supportive with them. So that's one thing. Now, on some of these older nurses who like to kind of eat their young, here's my little trick for them. Like sometimes these nurses who've been working like 25 years or more, they have so much experience and so much knowledge, and they know so much, right? Like they have seen it. They have lived it. They know way more than any new grad nurse could ever know. Even a straight A student passed their NCLEX in 75 questions. Until you get these experiences, you're still kind of a newbie. And I think some of these older nurses, they feel maybe a little intimidated by these new grads coming out with their bachelors and thinking they know everything. And I think that maybe sometimes causes them to lash out or like eat their young. And it's not appropriate ever for someone to bully, a new nurse or whatever. But sometimes with these older, more experienced nurses, a little bit of kind of recognizing their skills and experience can go a long way. Like letting them know, like, wow, you have so much experience. I would love to learn from you. And if you wouldn't mind taking a moment to kind of share how you do this best, like how do you organize your day? Can you show me the best way to do this wound care? Really look to them for support and guidance. If you can kind of recognize that they have these valuable skills and that you look up to them and respect them, and if you can engage them and ask them to kind of help you, then I think that goes a long way to kind of disrupting this nurses eat their young thing, right? I think they'll see that you're eager to learn and that you respect them, and that helps them kind of stand down and be a little more respectful in some cases. Okay. Thank you for all you do for us aspiring nurses. Yes. Cancer videos. Yep. We're going to be covering that too. Lots of good stuff coming. Definitely subscribe here on YouTube and sign up on our email list on the website as well. Okay. Let's see. What do you say? We practice our skills at home since we're not able to have clinicals at this time. Yeah, so nothing is going to fully replace like hands-on skills, but you can definitely watch videos of skills. Like if your school system is using Elsevier or some company where they have like videos showing different skills being done, then definitely watch those. I also used to just randomly watch different YouTube videos about IV starts and stuff like that when I was really trying to get my head around how to start IVs. So definitely watch as many videos as possible. Some programs have simulation type labs that you can do online, which is obviously better than nothing. And just know that once you get back to clinicals or become a nurse, you're going to get lots of, hands-on practice, hopefully. So just hang in there with that. Okay. Like many of us, we are finishing the rest of the semester online, which is completely different. It's hard for me to focus. I get that. Any advice on finding my groove in an online learning environment? Yeah, so my kids are home, like my daughter's home from college, and she's having to focus here online. Maybe she can come in and give us some hints. Hey, Sarah, you want to come here and give some hints on how you focus with online learning? What time is it? How are we doing on time? All right. So, okay, I'm going to pull in my daughter. She's here from Berkeley. Here, come sit down. This is Sarah. So we went and picked her up from Berkeley on under duress a couple weeks ago. It's been 2 or 3 weeks.
Yeah.
And so people are struggling with here. One of the questions is, it's hard for me to focus. Any advice for finding my groove in an online learning environment? How have you struggled, or what have you found that helps you?
Yeah. So when we moved back here, when they took me back here, all of my classes also shifted to the online. So we have Zoom lectures, and all of the discussions are online now too. And I'm not sure if it's exactly the same as what you guys are going through, but one of the hardest things for me has been for the classes that really revolve around intense communication with GSIs or with other faculty. It's sometimes harder to connect with them and ask the questions. Like, it's a lot harder to make that leap. So I'd suggest just being really diligent about that and making sure that you're joining their Zoom office hours or however you can connect to those people. And then the other thing I'd suggest is when you're home, it's really easy to not focus. And like you were saying, like it's a very real concern. So if you have like a separate space in your house, like when you wake up, one thing that I've been doing and that my friends have been doing is do everything that you would have done had you been going to class. So wake up early, get dressed, don't stay in your PJs all day, make yourself breakfast, go to a different room as if you're going to whichever class you're going to, and set that aside as your workspace and your work time.
Yeah.
I wouldn't.
So keep a schedule, keep
a schedule. Yeah. Don't do everything in bed. You're gonna,
that's really good advice.
You're going to get distracted. But that's just coming from a college student. You guys are nursing students.
Right. Well, they're in college. They're in college. I mean, different type of program.
For sure.
But I think, not like being in bed or getting too comfy, right? Maybe even standing up. Like, she has like a little stand-up desk, but maybe at the counter, like standing up will help keep you more engaged and awake. Noise canceling headphones. Maybe noise canceling headphones.
Sure. Just whatever you would have done either way, just try to eliminate the distractions around you and make it as close to what it would have been had you been taking the class in person.
And what about exercise? Like for me, if I go walking or running and I come back, the endorphins from that it helps me feel more motivated and I'm more productive when I get back. Do you find that to be the case?
Well, I know that you used to, when you were in nursing school, I'm sure they've probably heard this a bit, you used to take your flashcards out on walks and study while you went. And so that might be really relevant for you guys. You're using your flashcards.
That was super helpful for me.
Mom did that all the time. For me, I don't know. It's if I feel really motivated, I'll do something, but I'll admit I've been pretty bad about exercise and getting up and moving around.
But you've been good about sticking to your schedule and reaching out to teachers during office hours and not studying in your bed.
Yeah. Oh, and one other thing about doing stuff at home that I've read a lot about and I've thought about too is that when you're home, it's really easy to work all day. If you get into that groove, it's really easy to start at like 7 and keep going until there's nothing left to do. But I think it's really important to set boundaries while you're home too, because you wouldn't have done that if you were at school, or you likely wouldn't have. If that's your normal routine, then that's what it is, but you don't want to burn yourself out. Because it's a little bit harder to stay focused and to stay, hold yourself accountable when you're not going to class. And some of the grading things have changed. I'm not sure how your situation is, but give yourself boundaries too and make sure that you're taking time for yourself.
Taking some breaks and stuff like that?
Yeah. Okay. Or like have a cutoff time, have a start time and a cutoff time.
Okay. That's some good advice.
Yeah.
All right.
Balance.
All right.
Okay.
Thank you. Bye. Thanks for the advice. Okay. So not doing your work in bed. I think that was like the big takeaway from me. All right. Let's see. How about let me make sure I have all these questions, or at least I've kind of touched on some of this stuff. Okay. Will we graduate on time? depends on your school, right? Like I see some schools working hard to make like accommodations for their students and some states are helping students like redistribute their clinical hours or graduate, without fully having all their clinical hours. So talk to each other, right? Make comments here on this live feed. If your school's doing some special things to help accommodate and allow you to graduate early, then maybe get those ideas if you're at a school where they're not doing those things, and really advocate for yourself and your classmates, because there are schools doing things to help support students so they can graduate early. So it really comes down to advocating at your school so that you can do the same. Okay. So someone asked me, this was a good question. My goal is to become an RN, either an ADN or BSN. And I was thinking I wanted to start off with a CNA and then get a work experience and then maybe work while studying in an accelerated program. So there are so many different paths, right, to get to be a nurse. So you could start as a CNA and then maybe become an LVN and then an RN. You could go straight into an RN program. So some things to keep in mind. Starting as a CNA is a really good idea for a lot of reasons. One, it gives you experience in a healthcare setting, like at a hospital, and you can really see if, nursing is the right path for you. So many people think they want to be nurses. Then when they actually get in the hospital and start doing stuff and seeing stuff, they're like, I don't know. Like some people, it sounded good, but it's not an easy field, right? You work. There's a reason why, nurses do pretty well salary wise, but you work really hard. You're earning that money. So working as a CNA when you're just like starting down this path is a good idea, just to make sure it's the right path for you. Also, if you can keep that CNA job while you're going to nursing school, when you graduate, then it will help you get a job more easily, right? Because a lot of hospital systems give emphasis give preference to internal candidates. So those students who are working in their hospital system will get first dibs on those new grad positions. So that's another reason why having a CNA job, or I was a transporter during nursing school, and that got my foot in the door and allowed me to get one of the new grad positions at my hospital. In terms of like doing the whole LVN, licensed practical nurse route, or going the RN route, keep in mind that there is a lot of overlap between these two programs, right? You're learning a lot of the same information. The key difference is scope of practice. So if you're going to do an LVN program, that's great. There's going to be a lot to learn and just work hard. And I would definitely recommend doing a bridge program after that to become an RN, because not only is the salary better, there's just a lot more options job wise for you as an RN versus an LVN. So, but going that path is great, but I would definitely, if you can, plan on doing a bridge program after you get through your LVN program. And if you study with our materials here, which are designed to help both RNs as well as LPNs, then you're going to be well positioned to do well in that, that bridge program. The other thing to keep in mind, if you're like a pre-nursing student thinking about nursing school, you need to know that in many geographies here in the country, it is very competitive to get into a nursing program. Like here in Southern California, it's brutal to get into a nursing program. Often those associate programs, ADN programs, are even more competitive or brutal to get into because they're the most cost-effective programs. But either way, BSN programs, ADN programs, they're all very, very competitive. So when you are setting out to do your prerequisite classes, you're going to want to do them slow enough that you're going to nail them, that you're going to get straight A's, because in a lot of places in this country, you need to have straight A's practically to get into nursing school. So, for example, it would never be a good idea to take anatomy, physiology, and microbiology all the same semester, right? That's just a death wish. You want to take your classes slow enough that you're going to get A's in them. You're going to master the material. So that will set you up to get into nursing school a lot better. Also, when you take your TEAS test or whatever test, like entrance exam, you have to take to get into nursing school. For a lot of people, that's the TEAS exam. You really want to study for that ahead of time. You want to get one of the study manuals that are available and read it cover to cover and take practice exams so you can go in and take your TEAS test and do really well. And that will also set you up to be well positioned to get into nursing school. So those are some of my advice for people just starting on the path to go into nursing. And let's see. Let me just check out some questions here. You have such a good daughter. She's beautiful. You're really blessed. I love you guys. I am. I'm so lucky. My daughter is amazing. And so is my son. I'll get him on camera during another live session. I think he's working on schoolwork. Please shout me out. I watch your videos every day. My name is Ismael Ortega. Hello, Ismael Ortega. Hello, my clinical instructor, Barbara Ritchie, told me about you, and I just graduated LPN school. We need to take my NCLEX. So I'm wishing you luck on NCLEX, sending positive thoughts your way, Chanel. I know you'll do great. Great advice for sure. Thanks, Sarah. Let's see. Is there a way I can order your flashcards and customize my value pack? Yeah, I think if you put enough, I think, is it 4 cards or maybe it's 5 cards, you get a discount automatically applied. So there's 2 different packs going on right now. There's a fast track nursing review pack, and I think there's one other pack. And Angelina might be able to tell us here. She'll put it, I don't handle that side of things as much. I'm really focused on the teaching. So Angelina, maybe you can tell us what the other pack is, but we have 2 different pack deals going on right now that are really good, good price right now. Let's see. This fall, I have 16 credit semester. I'm older with a mortgage and a family. Is it appropriate just to work weekend days, 12-hour shifts, or a traditional 3 12-hour shifts? What do you recommend? Wow. So this is Ustin E. Yeah, you're going to need to work as little as possible. I mean, if you can just work like 1 12-hour shift, that's best. If you can, I mean, as much as you can manage with, like, I know it's just a balancing act with mortgage and school and family. It's a lot. I totally get that. So for me, when I worked as a transporter during my accelerated bachelor's program, I worked part-time. So sometimes I would only work 1 shift a week, sometimes 2. So as few shifts as you can get away with to be able to pay your mortgage, I would recommend that, because 16 credit hours is no joke. It's going to be a lot. And with a family, it's a lot. So do what you can, but I know you've got constraints, so I can't tell you not to do certain things. You got to be able to pay your mortgage. So just sending positive thoughts your way on that. Okay. I told my whole class about cool chicken. Yeah. So I love cool chicken, and that seems to be people's favorite little weirdo hint that I have. But I got lots more weirdo hints coming soon. Let me tell you that. Okay. Cathy, you are really popular in my nursing school. Everyone is buying your cards. Amazing. So I'm super happy to help. That's great. I'm really happy to help you and your classmates. I'm glad people are finding value in the flashcards. And Central California, Lexi, hello. Yeah, so you can always customize. 5 or more cards is for an automatic discount. Okay, let's see. Thank you for all your help. Flashcards are amazing. Let me make sure I've answered all my questions that people put out ahead of time. Okay. I start my LPN to RN program on Monday. What would be some recommendations from you to be as successful as possible in passing all my quarters? Okay, so good. You're getting ready to go with your program. Get ahead whenever possible. So I'm going to give you some just bullets here as far as advice. If you can at least, and then we talked earlier about trying to study multiple, a couple hours, multiple times during the week versus 1 huge session. and then figure out how you study best. When we didn't have this pandemic going on, my advice would be figure out if you study best alone or with a group or at a coffee shop or at home. And obviously, those things aren't options anymore. You're going to be studying alone, likely in your house. You're not going to a coffee shop or studying in a group. So I think it comes down to figuring out the right environment you can set up. Students kind of wait towards the end of their program to start taking practice questions. But if you can go ahead and start taking those like right off the bat in your nursing program, not only will you get really good at taking those NCLEX, answering those NCLEX style questions, you'll also just going to be learning the material at a much deeper level. So don't wait till the end of your program to take those practice tests. Do it throughout your program, and then you're going to be super well positioned at the end of your program to do well on your NCLEX. So those are my pieces of advice to really set yourself up for success. One other piece of advice, which some people aren't going to probably like, but one thing I did when I was in nursing school is when I had my breaks, like in between spring, summer, and fall, I would get ahead on the semester ahead. So if I knew there was some like busy work type papers, or I would get ahead and learn the material, I would usually use part of that break to really try to get ahead so I wouldn't be so overwhelmed during the semester. I know some people are like, that's my break. I need my downtime and I'm not going to study. That's cool. You got to do what works for you. For me, I would spend a little of my break doing downtime. Hi, Cathy. Love from a student nurse in Ireland. Hey, Richard. Stay safe. Yeah, I'm actually pretty fortunate. Yeah, I am going to the hospital twice a week, but I'm not like an ICU nurse. I'm a wound care nurse and to the primary nurse on how to take care of wounds. Like she or he will take pictures, and then I'll write orders for wound care and offer guidance. So I'm currently not going directly into those COVID-19 rooms, but I am at the hospital, and it's a very contagious, virus. So I'm staying as safe as I can, for sure. All right. I think we are pretty good. Cathy, you're awesome. Thank you for your devoutness. You are welcome. So I am going to end things here, but I did actually have one more question before I end things. So someone did write me a question. They said they're going into the nursing profession after a 2-year break. I am watching your videos to refresh my memories. Please let me know what I can do more. Thank you in advance. So watching our videos is definitely going to be helpful. And like I mentioned earlier, reviewing our flashcards while watching the videos is even more powerful. So we do have that fast track nursing review pack for sale on the website leveluprn.com. And it, like I said, it contains pharmacology, lab values, med-surg nursing, and health assessment. So, and I know Angelina shared that a little bit earlier. Will this live be uploaded? Yes. So all my live sessions here on YouTube are uploaded to YouTube. It happens pretty quickly, actually. It works better than when I was doing IG Live, which I would, as Angelina can tell you, I'm notorious for messing up, like not saving it right or whatever. YouTube kind of makes it really simple so I don't screw it up. So yeah, when we're done here, it takes a little while for it to process, for us to put like a little description on the video, and then we'll upload it. So it will be uploaded today. So definitely watch and then join me next week. So it seems Fridays are the best day for people to do live sessions. So we'll look at kind of the audience today, and I may put a survey out if I feel like another day may be better, but definitely look for announcements. And my plan is to keep doing these live events weekly to help people while they're at home during this pandemic to stay focused and, just to help you out. So take care, everybody. Thank you so much for your support, and stay safe. Talk to you later.